When you hear the phrase mental health, what do you think about? Chances are the first things that pop into your mind are depression, anxiety, ADHD, PTSD, and so on.
So often, when we hear the phrase mental health, we immediately think mental illness. The diagnoses, labels, pills, and therapies that are meant to treat disorders of the brain. In our society, the two terms are often used interchangeably, or they're considered opposites of one another, like two ends of the same spectrum, like this. This representation suggests that if you're not mentally ill, then you must be mentally healthy. Yet, by definition, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease. So, mental health is not the same as mental illness, nor is it the opposite of mental illness, as this graph might suggest.
There's more to experiencing physical, mental, and social well-being than not being mentally ill.
So then, what is mental health?
Let's consider the idea that we all have a state of mental health that changes across our lifetimes, despite the presence or absence of mental illness. Mental health is continually affected by many different factors.
Genetics, relationships, family, physical health, communities, and even government policies.
Your mental health ebbs and flows based on the interaction of all these factors. The more these interactions add up to positive influences, the more likely you'll experience what we call optimal mental health.
Optimal mental health is reflected in productive activities, fulfilling relationships with others, and the ability to adapt to change and cope with adversity.
Conversely, we can experience poor mental health when the interactions of our genes, relationships, communities, and so on add up to negative influences.
In these situations, we might experience less productive activities, unfulfilling or unhealthy relationships with others, and challenges in adapting to change and coping with adversity.
Because mental health changes across the lifespan and exists despite the presence or absence of mental illness, a clearer way to think about mental health is to consider two dimensions.
This model suggests that mental health and mental illness are not opposites on the same spectrum, but rather related and interactive states. For example, a person can experience anywhere from serious mental illness to no symptoms of mental illness. And at the same time, that same person can also experience anywhere from poor mental health to optimal mental health. Let's consider some examples. This is Cari. She was diagnosed with ADHD when she was 7 years old, when her struggles in school became overwhelming, and her parents and teachers sought a formal diagnosis in an effort to help her succeed. Cari began receiving therapy from a well-trained clinician. She attended a school with a curriculum that emphasized relationship building and received lots of support from her parents. With effort, Cari was able to excel in her classes in middle school and high school, and now is headed off to her dream college. The road wasn't always easy, but even with her diagnosis, Cari thrived and learned how to cope effectively with challenges and adversity. Cari shows us that having a diagnosis does not make it impossible to also have optimal mental health. This is Emilio. His parents have just divorced, and he feels sad, unproductive, and disconnected from others. His mother takes him to the pediatrician, who gives him a thorough assessment, but determines that Emilio doesn't meet the criteria for clinical depression. She does give him a book about a boy experiencing divorce, and this helps Emilio understand his feelings. Emilio's parents participate in a program for divorcing families. He's able to join an after-school program that promotes social skills, and he starts to feel better the more he reconnects with people, and soon Emilio feels like his old self again. Emilio shows us that having no diagnosis does not guarantee good functioning.
So with so many factors at play, what does this mean for understanding the mental health of families and children? Using a public health approach helps put these factors in perspective.
Public health is concerned with whole populations of people. Successful population-based public health campaigns have focused on reducing smoking, encouraging prenatal care, and eating healthy foods. These campaigns have led to sweeping changes and improved health within entire populations of people.
We can approach mental health in a similar way by working toward optimal health for everyone, not only those who are ill.
Public health also emphasizes creating healthy environments. Programs that create smoke-free spaces and eliminate food deserts change the environment, which then changes the behaviors of the people who live there. Finally, public health approaches encourage health promotion before illness occurs. Promoting mental health can happen in home visits to new parents, high-quality early childhood programs, and healthy youth activities that build self-esteem.
These programs help people have more control over their lives, including their mental health.
You can use a public health approach to become involved in promoting children's mental health by working with children to improve their self-esteem, communication skills, and ability to regulate their emotions, engaging parents in healthy parenting practices, conflict resolution, and learning about child development, incorporating mental health promotion activities into our schools, social service agencies, and other organizations serving children and families, changing policies so that children have secure housing, healthy foods, safe neighborhoods, and access to healthcare, and reducing stigma about mental health and mental illness. You can find more information about public health approaches to children's mental health by following the links in the description section, or visit the Extension Children, Youth, and Family Consortium's website for more information about our work related to children's mental health.
And as always, thanks for all you do for children and families.